Welcome back to the CarePaths Connect introductory video series. This is the second of 3 videos, and it will cover how to turn on the automated measurement-based care feature for new and existing patients. If you're not already familiar with measurement-based care, it's an approach to psychotherapy that has been shown in studies to improve outcomes across a wide range of different kinds of therapy. We developed this new feature so that all our users can easily benefit from the practice of MBC. For more information on how to practice MBC, we highly recommend viewing the webinar we produced with Dr. Bruce Wampold, the world-renowned psychotherapy researcher and CarePaths Chief Clinical Officer. We'll show you where you can view that in just a second, but first, to activate the automated measurement-based care feature, your practice admin will again need to log in to the CarePaths EHR. Then they'll go to the same place they went to activate CarePaths Connect, under the admin menu, clicking on CarePaths Connect. From here, they'll go to the Measurement-Based Care tab and click Authorize. Now what this does is it authorizes CarePaths to send your patients an SMS notification 3 times per week, prompting them to fill out a set of 2 brief assessments. On Monday, the assessments will measure symptom severity. On Wednesday, they'll measure well-being and loneliness. And on Friday, the assessments measure the therapeutic relationship. On the bottom of this page, you'll find the link to the webinar with Bruce Wampold on our sister site, Making Therapy Better, which will give you a better idea of how to use the information that is collected in these assessments. You can also receive continuing education credit for viewing the webinar by completing the evaluation and post-test. Dr. Wampold will also be writing a series of blog posts on NBC, including an explanation of why we chose these particular assessments to be included in the protocol. So be on the lookout for those here in the CarePaths blog. Now keep in mind that clicking Authorize will automatically sign up any new patients to receive the assessments, but existing patients will need to be added manually. And that can be done by the clinician. It doesn't have to be the admin. So to do that, just go to the patient's chart, click Auto MBC, and click the button that says Enable, or if they're already turned on, you'll have the option to disable them here. Now let's look at a patient who's already completed some assessments. As you can see, once the patient completes an assessment, you'll see on the front page of their chart these graphs displaying the results. Each graph will have 2 lines, one for each assessment that goes out on that day. As you can see, this patient hasn't completed very many assessments, but as they complete more, you'll be able to see their progress over time. This vertical blue line represents an appointment so that you can see how your patient's progress corresponds to their treatment. And this red line represents the clinical cutoff, where scores below the line are considered in the normal range. We strongly believe that just having access to this information will be beneficial, but ultimately it's up to you as the clinician in collaboration with your patients to decide how to act on this information. So again, we recommend viewing the webinar and those upcoming blog posts for more ideas on integrating MBC into your practice. Thanks for watching this video on how to activate automated measurement-based care in CarePaths Connect. The next video will walk you through the experience of using the CarePaths Connect app from the patient side. We'll see you then.